Hi parents, I'm Dr. Shivani Deswal. I'm a pediatric gastroenterologist in Gurgaon. Many children come to me with chronic constipation. They have history of taking laxative for many years. They are not able to taper their medicines. They have history of prolonged toilet time. They have history of incomplete evacuation. They have history of pain after passing stools. They also sometimes use their finger to pass stools. These are signs of chronic constipation and suggest dyssynergia. To explain what dyssynergic defecation is, when your child has chronic constipation, his behavior of normal stool pattern changes. I can give an example of a toothpaste. Like if you push the toothpaste from above, but you do not open the cap, the paste will not come out. In similar way, if your child sits on the toilet, pushes from the abdomen and the tummy, but does not relax the lower part, the anal sphincter, the stools do not come out. And when they do not come out, it causes them pain. It causes them feeling of incomplete evacuation. It also tells them to go to urine very frequently, or when they go, they just pass small amount of watery stool and come back and they have to go to the toilet 3-4 times. These are all signs of dyssynergic defecation. If your child is having any of these symptoms, you must consult a pediatric gastroenterologist. We usually take a detailed history, do a physical examination, and also confirm this diagnosis by anal manometry. Anal manometry is a simple test which just takes 5 to 10 minutes. It does not require any sedation. It does not cause any pain to your child. It is done by a very compact machine where we see the pressures and the color changes on the graph when your child does a normal stool pattern. So if we diagnose dyssynergia, then we advise biofeedback therapy. Biofeedback therapy is done by me, a pediatric gastroenterologist. It consists of 4 sessions, which are around 25 to 40 minutes each. In the first session, I sit down with the parents and the child to explain them the physiology of defecation, their anal manometry report, how is his diet and fluid pattern, his normal toilet timing, his toilet position, his stool chart. And I also teach him the exercises which the child needs to do at home and come back to me after 5 to 7 days. In the next session, we do biofeedback therapy with the help of a machine software. It is a visual and an auditory clues that we give to the child. It's a very fun way of doing things. Children find it very interesting and they enjoy it. We just put a small balloon in the anal sphincter, and then the child is shown on a TV the various color changes along with audio clues. There are sometimes games that we play with the children, like fish catching the ball. And we explain them how they're supposed to push and how they're supposed to relax on the toilet. Once the child's mind understands this, we reinforce it by a third session while he continues to do his abdominal and other exercises at home. It is usually seen that by the fourth session, children have learned the normal pattern of stooling and their laxative doses start going down. And in my experience, around 95% of the children with dyssynergic defecation have responded beautifully to this therapy and their laxatives have been stopped. I think it is very important in our community to understand this biofeedback therapy. Biofeedback therapy is a mind-body technique where you teach the mind how to coordinate. It is also being used in disorders like rumination, where the child has persistent puking without any endoscopy diagnosis and no other organic illness. In that also we do biofeedback therapy, breathing exercises in which we help the child to control his rumination. So if your child is having chronic constipation for months and years, if you are unable to decrease the low dose of laxatives, if your child is spending a lot of time in the toilet, if your child comes back from the toilet and says he has pain abdomen, if your child passes stools but small amount liquid stools and has a feeling of incomplete evacuation, if your child is having soiling in the panties, so it is time that you get your child evaluated by a pediatric gastroenterologist, get an anal manometry done, and if your child is suffering from dyssynergia, biofeedback therapy can help in relieving all his symptoms.